Our next speaker. Thank you very much. Quick introduction, Eric Young from Xand. I'm the Director of Channel Sales for Xand. Xand is a data center managed service provider based here in the New England area. I'd also like to thank everyone who knows for this event today. I have the pleasure of introducing Jyotin Gambhir. Jyotin is currently the Director of Fairchild Consulting, building a security and privacy practice. Jyotin, before joining Fairchild Consulting, Jyotin built SecureFLO, a consulting company that provides advisory services to clients in the areas of security and risk. He has over 18 years experience with Deloitte and SecureFLO. Some of Jyotin's credentials are, he recently published an article in the DRJ titled Information Security, BYOD, and Organizational Behavior. It's my pleasure to introduce Jyotin of Fairchild Consulting.
I'm just going to test if everything works. Yep, very good. Thank you very much. Thank you for the opportunity to speak to you, speak to this great audience. It's a beautiful venue, and it was just beautiful driving in this morning. Unfortunately, the sun didn't come out, but you know, it's still it's a phenomenal place to be able to speak. I wanted to start with just talking to the audience about your experiences in mobile security and security in general from your organizations. As far as what you see, how mature well actually let's start with how many organizations actually have a Chief Information Security Officer that manages their organization? So I see almost 4 or 5 hands. That's pretty good. And as far as percentage of organizations that then have a security department that communicates with the other parts of IT, operations, business in general. I guess that's the same number of. So that makes sense. So, you know, I think what I have seen, and that's essentially what I'm going to be speaking about, but also industry trends, what we see in the market, and personal experience as well as technology experience. So this is an interesting fact. So it's healthcare obviously is a very important business now, especially from an IT perspective, but also from an overall perspective of money spent. When the GDP numbers came out a week back, the GDP numbers increased because of the amount of healthcare spending due to the Affordable Care Act, as you probably know. The interesting thing about that as well is that they have just done a study as of yet last week that the number of breaches have increased 62% in 2013 from the previous year of the attacks that have happened, thefts of EPHI or patient health information. So I wanted to start with what the Department of Homeland Security considers an imminent thing as far as the failure to implement robust security program will impact the organization's ability to protect patient and their medical information from intentional and unintentional loss and or damage. And that's important because obviously this is not only a business issue, but it's a government issue at this particular point in time, because they, through regulations, but otherwise also are concerned about patient health information enough to make statements such as that and look at further regulations and as part enforcement. The types of breaches which have been interesting, it's interesting the highest breach that has occurred is due to theft. And the theft that takes place is primarily laptops, and that actually has been Macs and iPhones and those kinds of devices which are cool. And it's not because of PHI, but it is something that has to be reported as part of the HIPAA High-Tech Act. The second most, what seems to be the theft that takes place is unauthorized access to disclosure. And that basically has to do with the fact that people have access to information and systems which they should not have. And that could be employees, non-employees, contractors, vendors in your organizations. And so they've kind of broken it down, as you can see, into loss, hacking, IT incidents, etc. But what's notable here is the media containing PHI, and the highest degree of loss is on laptops, but the second is paper still. So ePHI, even though is something that everybody talks about, but there's a lot of sensitive data still on paper, and continues to be so. And so paper is as much of a risk to the organization as is electronic. Though today we're going to be talking more about the mobile and the electronic piece of it. So every day you open the newspaper and it seems like there's something new. I think you obviously are familiar with being in healthcare and, or being associated with healthcare. Children's Hospital had this incident, and this was more of a social statement or made by anonymous a hacktivist group, as they call themselves, because of the case where Children's Hospital sided with the judge on the case of Justina Pelletier, where she was taken away from her parents by the state. Then there's been the Utah Department of Health, and I actually chose a few. They had 780,000 records lost, and that was because of somebody actually used a jump drive, and it was not encrypted, and they left it at actually a train station. Forgot about it, just didn't realize it until later, but because they couldn't figure out what was on that, but they knew they had patient data, and they knew it was not encrypted, the hospital system had to report. Emory Healthcare, on the other hand, also lost 315,000 patient data, and this was more of a breach, but it was a breach of a different kind. This is an operational breach where they had backup disks. The backup disks were lying in locations which were obviously not, one, encrypted, but also not in a secure location. They were lost during transport. And again, because being not encrypted, and they just couldn't figure out exactly what was on it, they had to report the maximum amount, which was 315,000, that those disks could hold. South Carolina Department of Health had another incident where they had 228,000 patients, where an employee sent that information to a private email account. So he himself sent it to his own private email account. In this case, obviously a disgruntled employee, but it's as easy as that when it becomes electronic, especially if there's no monitoring on the side of the organization. Harvard University Hospital, they had they lost about 34,503 patients. Again, a disclosure of PHI because I think this particular incident was actually a hacking incident where their systems were hacked and they lost data. So what I wanted to talk about, so there are interesting numbers. There's been a lot of research done on what's been happening. So 24 million is the number of PHI, electronic PHI records that have been lost between 2009 and 2013. And you can think about that. That's a sizable number of patient health information records lost. There have been 730 incidents in the same time, also, which includes the projection for 2013. There have also been 29.3 million people that have lost patient health records, which had HIPAA data breach since 2009, and that basically comprises of a 138% jump since 2012 of HIPAA incidents. So what's interesting there also is that hacking doesn't figure prominently amongst those particular incidents. less than 20%, less than 20 incidents per year, and only 10 in 2013 were actually hacking incidents. Rest were, again, theft, unauthorized access, and the list goes on as to what takes place in the organizations. There are 14 incidents that were related to employees and contractors. And it's interesting, they've again done research around that. Those employees and contractors where they lose data is employees who have been in a company for 5 years or more and are generally at a managerial level or higher. And those are the employees who have this, where the breaches have taken place. The media most often involved in incidents, again, is laptop paper and then USB sticks. It ties in third place with the servers. There's a loss of data on. There's an iHealthBeat journal. They've done a study where they said 58% of medical organizations today allow bring your own device and programs such as that. And this is primarily, again, healthcare. And out of that, 46% encrypt data, which is stored on these devices. So they allow the personal devices, but the reason it's not encrypted is because of policy, because there's no enforcement and there's no clear governance and policy from the top to say it must be encrypted, and then there's enforcement doesn't exist. So what I have seen and what we've seen in the various healthcare organizations, what is the scope of mobile devices? And I think primarily the conversation is always about smartphones, it's about tablets, it's about laptops. But that's not what is the only thing that needs to be looked at for healthcare organizations. So today we have, of course, laptops, smartphones, and tablets, but we have implanted devices. So there are pacemakers and insulin pumps. And in fact, there was in Black Hat event, a security event where the hackers get together in 2009, this gentleman, Kevin Fu, had shown as part of a demo on how he could hack into an insulin pump and change the insulin levels for a patient who actually has an insulin pump implanted. There are external devices. So there's defibrillators that can store patient data. There are wireless medical devices where we are looking at devices for diagnosis and for treatment, which are used across many hospitals today. There are many hospitals in specifically anesthesiology today are experimenting using Google Glass. Philips has brought out this product which actually uses Google Glass with their application and allows anesthesiologists to administer anesthesia, and it's being tested in many of the hospitals that actually have witnessed it myself. There are robots being used to both deliver patient care and deliver drugs. There is a company called Vigo Robot which has robots which are prominently actually used across many hospitals in the country, but specifically in New England today, and being tested. Again, there are major wireless security concerns, major mobile security concerns around these devices. So this is essentially what we're looking at as scope of what to secure or what to manage from a security and privacy perspective. So there's, as you go around, everybody talks about what's the regulation that you're looking to follow, what are the standards that you follow in your IT organization, and actually, I'll ask you guys, apart from HIPAA high tech, what is the other specific regulation that keeps the organization, senior management up at night, or where the enforcement is as much as HIPAA in healthcare? Anybody?
You really need anything bigger than HIPAA.
Well, you don't need anything bigger. I think what we're saying here is there are other regulations, and So, some of these have been left behind. So 21 CFR Part 11, for example, a federal regulation. ICD-10, which Pam just spoke about, and obviously is being enforced, and there are security components to ICD-10 as it gets implemented, or it's ICD-11, it seems like that's what's next. There are, of course, federal regulations around FISMA, and FISMA is important also because that's part of how NIH funding is given. So NIH today, when they give funds to hospitals, want a security assessment done of the organization. They want to know how the data, the overall data life cycle is managed, how data is accessed, how data is stored, where it exists in the life cycle, and how it's disposed of. And that needs to be done as part of applying for a NIH fund and approval. There are, of course, FDA regulations, so you must have heard of servers which are FDA certified. There are vendors who will sell FDA certified devices, and there are security components around those FDA regulations. There is the prominent state regulation, 201 CMR 17, which is in the state of Massachusetts, and there are similar regulations around the country in each state. There are PCI regulations, which is now actually one of the larger, I would say after HIPAA, is the largest one for healthcare organizations to consider, because there are huge PCI fines being imposed on healthcare organizations that have basically looked the other way on PCI regulations, and they have, in their international departments where they treat embassy patients or patients from outside the country who pay cash, which is a big industry in healthcare. Credit cards are being taken and other forms of monies are being taken. And so there are PCI regulations which need to be adhered to. And then, of course, there are other state-specific regulations. There's the ID theft law and specific regulations around education. And what I wanted to do with the standards was I wanted to differentiate. So the standards are actually helping organizations to meet these regulations. And it's important from a security perspective to look at standards before you look at regulations, because regulations is you're basically addressing small components of an overall security program. So if you were to deploy things of the nature of an ISO 27002 or 27001 or a NIST or a FIPS standard in your organization, you would not only meet these regulations, but across the board you would do better in answering questions as to how your organization manages security. And it would give an understanding of your security posture and your understanding of risk in your organization.
Does meaningful use come into play on this overwhelming list?
Yeah, meaningful use, absolutely. I left it out, but yeah, meaningful use is a large component because these days every hospital, at least on the provider side, is looking at meaningful use stage 1, stage 2, depending on where they are in their certification process.
And on the provider front, I think a lot of doctors' offices thought they didn't have to do the security risk analysis, which they had to do. They tested, they took the money, and now they're dealing with meaningful use audits. And I think they're going to have some unpleasant surprises.
That is actually correct. I think as part of the book of evidence for certification, there is a risk assessment required for each organization. And those organizations, some of them did not actually look at the interfaces where and how that data was being transferred. They just looked at the front end, where the data was being accessed for the various metrics that needed to be met. And so there have been audits, and there have been fines.
Or they just simply check yes.
That's correct. Or some of them
You've
actually.
heard the word HIPAA before.
Yeah, absolutely, and that's a pretty common thing. It's not something that obviously is recommended, but there are smaller organizations that cannot meet the budget of an IT risk assessment, security assessment, or don't have the skills to do so, and they have done that. And actually, that is the movement in the direction of, as you would see, cloud, because that's the transference of risk to managing data in your own data center and data servers and moving into the cloud. The cloud does provide you better capabilities in many cases, provides you better security in many cases, but that has to be looked at as part of an organization. And it's an organizational decision, and the risk has to be measured. So what I wanted to talk then about from my experience, and I wanted to make it more interactive also from your organization, or what you see in your organizations, is to what we see as the approach to security from a mobile enterprise, but also from an enterprise, just in general, the enterprise security perspective. Right? So I've looked at it I started my career actually with the, interestingly enough, I'm an Indian, I went to the Israeli Air Force and worked in Tel Aviv with the Air Force to develop products, understanding their security postures. We developed products from a mainframe perspective, shows my age, but from a mainframe top secret perspective, and which we brought to the US market, which was then sold to BMC, and I worked with vendors like IBM, etc. And then moved to a audit perspective of auditing, as part of Deloitte, auditing organizations as to how they manage security. And the primary focus in Deloitte was financial services, but healthcare was close second in that regard. So based on that experience, I think what I have seen and what we see, especially in healthcare today, is that if you look at what an organization should be doing, I think governance plays top of mind as far as, and I'll describe what I mean by governance. Then the operations piece, and this is IT operations specifically, technology and education. And I think education, I could say, is probably as important as the governance piece, especially in healthcare today for the business user and for the doctors, providers, and nurses. So from a governance perspective, what we're talking about here is establishing a direction, and that's where I started talking about standards, following a certain standard. So it's important to have not only a direction in terms of where you want to go, and that's kind of a vision goal statement, but also an understanding of what is, to my organization, a risk posture that is acceptable. Because obviously I'm not going to take every level of risk and try to remediate it. So I'm going to understand that what I consider low risk is something that I will manage internally but will not remediate. Medium to high risk are the areas that I'm going to look to remediate, and high has to be in this time frame. So that perspective from a business has to be documented and should be documented. And I think from a regulatory perspective, there are requirements to have an information security plan. And that's a good first step to say an overall program, document exactly how you're going to be managing the access to your data, how you're going to be managing storage of data, where the data is going to be disposed of, and these aspects of data as data is interfaced and moves, and the transport of data. That all should be understood, managed, and documented. And that should be part of your overall strategy from a security perspective. And this is IT security, so that business understands where it needs to go. From an operational perspective, I think it's important to look at security as a management of the data lifecycle. So don't look at it from that I'm going to have a good firewall and a server in front, and I'm going to look at and everything's going to be encrypted on the transport layer. But look at it from a perspective of what I consider sensitive data and what is not sensitive, and how I'm going to manage those two differently. And and then you can start to understand where they sit. How do I manage things of the nature of, how do I patch the information? How do I manage my identity for my users? How do I manage things of the nature of storage? So do I use encryption or do I not use encryption? So those decisions can be made as part of operations after understanding what is considered sensitive and not sensitive, and how am I going to delineate, separate that? And data has become the property, intellectual property for most companies that's going to drive business for the next, I think, decade or more. It's going to be data that is more essential than the bits and bytes of servers, etc., that you're going to be trying to protect. So looking at the overall data cycle and looking at operations is key. And then I think comes the technology piece. And what I've done here is I've tried to divide technology in an organization separately as to how a security officer would see it. So there are aspects of security which are physical in nature, which is the data center. We're looking at access to buildings, it's your badges, as you get access to locations which are sensitive. So in hospitals, there are areas like nuclear medicine, there are areas specific to patient care, emergency room, where servers are kept. So how do you manage access to those organizations? How do you manage access to those physical locations as people leave the organization? And so then you're looking at your, in case of emergency department, you're looking at physical access as far as, the people have to take people from hospitals, transport them to another hospital, who those people are managing that piece of it. Then there's the people security piece of it, and that I think most people would understand as the conducting the background checks, understanding who people are, who is a permanent versus a contract employee. Is contract employee high risk for me? Is permanent employee similar risk? And that's something a security officer or a security position should look at, review as part of what is considered risk. Who are my vendors? Who are my third-party partners? Where does my identity risk lie? So in healthcare, as part of HIPAA High-Tech, there are business associate agreements. And I think every vendor who has ever sold into healthcare now will understand that the security department will always come back to you and say, do you have, or are you going to be able to sign a business associates agreement? And that is absolutely key for the healthcare provider, healthcare organization to protect themselves in the case of a breach. As part of the omnibus rule, which was passed recently, the government has actually asked the healthcare providers to even take the vendors and ask them if they use a third-party vendor as part of like a data center they store their data in, or they have other services as part of that whole package. They need to have BAs with those other third-party vendors as well. So it's not only the vendor with the provider, but the vendor with its other providers that provide that service, especially in the cloud environment. So you're looking at that, and then from a people security, obviously you're looking at visitors, you're looking at how people manage their data center access, who is allowed to go, how vendors then manage, are given access, temporary or permanent, to data centers to perform services as part of SLAs that they need to, or as part of help desk tickets that are open for their organization. Then there's the data security piece. And so then the data security piece is interesting because then when you're talking about data security now, you're talking about intellectual property, you're talking about trade secrets, you're talking about aspects which are very essential to organizations. So if you look in, not only in healthcare, but in pharmaceuticals especially, the primary goal there is to protect intellectual property and to protect where they are in the maturing cycle of their drug, how many drugs do they have in their pipeline. So the data piece becomes all the more important. So data security is important. Understanding your databases, where they are, how do you secure pieces of data in the database, elements of data as they call them, and how does the data flow? So the flow of data is absolutely critical. Where does it flow? Where does it sit? You are looking at the overall life cycle. Then there's the infrastructure part of security. So this is the what you would be calling remote access to your environments, the VPNs. There's we look at the networks, so the network security, which is the back end where there's the access, the firewalls, we look at the network servers, the intrusion detection services, the alert services, and so we look at the whole gamut of security in that area. There's the application level of security, so it's as to the application, how is the application developed, Are there areas in the code that are insecure to or are vulnerable to SQL injection attacks, to distributed denial of service attacks, which are DDoS, is the short term which is used a lot in the newspapers. There are websites, so there's access to websites because obviously a lot of applications provide access to their application through URLs or HTTP sites or HTTPS sites. What is the back end of that? So security needs to look into application level. And then there's crisis management. This is the overall understanding of disaster recovery, having BIA plans, having RTPs, having an understanding of how far are your data centers from each other? Are they on the same power grid if there was an environmental disaster and a certain power grid had to be shut down by the state? If you're on the same power grid and both data centers happen to be on the same power grid, basically you've lost everything in that regard. If there's a fire, obviously you're looking at multiple data centers. How do you replicate? And drawing up not only the IT piece of it, the business piece of it. So if business looks at it from a perspective of how do I provide patient care today, where if I lose data, can I still provide patient care? Can I provide it by paper? That whole aspect needs to be documented. So this is all part of what we consider security. So just when somebody talks about security, I know there are pieces of security everybody looks at and says, oh, security, well, that's malware and virus. But there's a lot more from a mobile and otherwise enterprise security that we need to look at. Education, and I think education is key, especially in healthcare today because of HIPAA high tech. So there's the data is held and used and accessed by nurses, techs, by physicians, by residents, and all other staff. They understand the importance of HIPAA, but they understand it from a high level, and they need to understand it from a perspective of what are the policies they need to abide by as part of their employee contract. What are, if any, if they bring their own PCs, what are they putting at risk? Who are they putting at risk? It's interesting, there was a study done actually recently where they talked about the fact that 74% people, employees, consider personal data more important to them than their company data. Just because there is no posture from the company perspective that their data needs to be secured and you cannot just access it. And obviously they don't understand how they're putting it at risk by going to Starbucks and accessing their application or downloading a file on their smartphone. So I think training and awareness programs are key. And the training and awareness programs should not only include what HIPAA high-tech is, but also what are the policies of the hospital and what are the tools available to the user to manage security, to manage the data, to secure the data. And I think a lot of the hospitals have launched those campaigns, but I think more has to be done in that regard for communication to occur between IT and business to have a clear understanding of what is in play here. So, in summary, I think what is the approach that we're looking at? So these are some of the things that we have seen have helped organizations. Obviously, I think I've talked a lot about data flows, right? So understanding data flow, data life cycle is absolutely critical from a healthcare perspective. Managing and documenting risk is very essential because what that means is what is my critical data that I need to secure and what types of critical data do I have in my system that need to be secured. So documenting what my risk posture is, developing governance, which I've already talked about, roadmaps, which are absolutely critical because again, there is nothing better than documentation because that way you can communicate to the business and you can get clarification as to what needs to be done or how business sees it. So a business might see it as a block to how they can conduct patient care. So there are a lot of communication discussions had with doctors and they say, well, if you put these roadblocks for us. We cannot really provide good patient care. And so the only way you can actually do that is by documenting what your posture is, documenting what your policies are, and then having discussions around that. Formulating a regulatory, business, and legal risk framework. So understanding your regulatory risk, understanding your business risk, but also understanding legal risk and how they come together. And that is essential from a security perspective, especially today because of the regulatory environment and the enforcement that has occurred due to the fines that exist in the environment. Developing and implementing standards, which I've actually talked about a lot, and then which I haven't touched on a lot, is vendor risk. So having a vendor risk assessment program is critical. Helping vendors to understand the risk posture, helping vendors to understand what they need to adhere by so that they can then provide that information to healthcare facilities is critical as working as partners together. And then, of course, training, I think implementing internal audit programs, which already exist in many organizations, but again, it's critical. And continuous improvement. And continuous improvement here I'm talking about is a life cycle of saying, these are the things we do, what are we lacking, how do we improve? And the only way you're going to be able to do that is by having good communication amongst business, IT, and IT in general. So security, talking to operations, to the DR folks, to talking to the patch people who manage the servers, the network people, and talking to management, the CIO and the CISO, and managerial staff to say, this is what we're doing, this is what you need to communicate, and these are the areas we are lacking in, or these are the areas we should improve, and these are the tools that are available out there. And I think that those are critical pieces. So that was essentially what I wanted to convey today, and I'll take any questions if anybody has any questions. Go ahead.
I have one on the internal auditing.
I have a question on the internal monitoring, audit trails and so on. It seems like people do that, but then they never look at anything. So how are they going to learn anything? I mean, to me, it's just like an exercise in futility to pretend you're doing it.
Right, so I think, it's a good question. I think, so there are internal audit in a lot of healthcare organizations, reports up to revenue and finance, the Department of Revenue and Department of Finance. They look at something called general computer controls. They manage the gaps, but their audience primarily is management, the finance staff, as well as their auditor. So if they have PwC or they have Deloitte or one of the big four, that's their audience. Unfortunately, the communication piece comes into play there. They do not communicate back to the people in the organizations or the departments as to their lacking of or gaps that exist and how the remediation is going to take place. And that is a critical piece of the overall communication that is lacking in healthcare. I think you have a question.
As you see people doing more cloud services instead of data centers, are you seeing more requests for consulting audits to help prove their setups in the cloud are compliant in all of these regulations?
So it actually is, it depends. So in some organizations, healthcare organizations, they have what they call a vendor risk program, and those people part of security look at all vendors, including cloud vendors. But what we have seen is there are companies both on the cloud side, so vendors themselves, but also healthcare organizations saying, as a vendor, what and how should I provide security so that the healthcare organization is comfortable with the security posture? What do I need to document from a policy perspective? How do I need to manage communicating what I've documented, and what are the controls we need to put in the cloud, including contracts, like a BA, a business association. And the healthcare organization similarly, but the healthcare organization more so are at a loss in understanding their primary goal is to get a BA, but they're lost in understanding the overall life cycle as to how many pieces are involved in a cloud and where the security risks lie. So they look at it as a traditional vendor and think, now that my server people don't have to manage my servers and there's nobody has to manage any of the data inside, I'm sure I'll be fine because this vendor does this for every other organization and they know security very well. And that's generally what we see in a lot of healthcare companies. Well, if nobody else has any questions, thank you very much. Thank you for being here today.